Good afternoon, everyone. Welcome to today's webinar featured by SpectraCell, and we are going to be talking about women's wellness and mind and body. And thank you for taking time out of your busy schedules to join us on our webinar today. We have a very dynamic speaker that you'll be hearing from, Dr. Roxanne Edrington, and she's been a long-standing friend of mine now for well over 15 years plus, and so it's been a joy to be able to work with her, and now to be excited to be able to have her conduct these webinars for us. So just a little history about SpectraCell. If you're new to it, we've been around since 1993, so a long 30-plus year track record in the lab industry. We're based here out of Houston, Texas, which is home to the world-renowned Texas Medical Center, so no surprise that we have access to some of the world's best technology and best practitioners in the city and throughout the state and throughout the country for that matter. I like to consider us a boutique laboratory because we are very specialized in the type of tests that we offer, and several of them we'll be going over today in the webinar as Dr. Roxanne shows how these various tests can help with a lot of the issues that we're dealing with in society. But the month of May is not only Women's Health Month, but is also Mental Health Month, and I just wanted to point that out, that we're not actually blending the two to say anything, but those are the actually two of the topics for this particular month and increasing awareness. We are a CLIA certified lab, and over the last 30 years, we've tested well over 1.2 million individuals, and so have a enormous database of being able to utilize our technology in comparison to that population as we provide results that no other companies in this industry are able to compete against. Not only in the United States, we have a global presence throughout Canada and Latin and Central America and throughout the Caribbean, also in Europe, throughout the Middle East to Israel and Dubai. And we are now entertaining the ability to move into Southeast Asia. One of the biggest difficulties we have is the type of test that we offer and the sophistication that they are, is we deal with live blood cells. And so it's important that we get those back at less than 48 hours before the cells die and allow us to be able to perform the test that we're doing. So enough of that about SpectraCell. Sit back, relax, hopefully have a pen and pad so you can take some notes as Dr. Roxanne goes through it. As I said before, Dr. Roxanne and I have been friends for well over 15 years. She's a doctor of chiropractic medicine and clinical nutritionist, naturopathic practitioner, certified in functional medicine, applied kinesiology, and a health lifestyle coach, public speaker, professional athlete. She's going to kind of go over some of her history and how she's become to who she is and living the lifestyle that she promotes to her patients and her clients. And is just an amazing individual, esteemed author, wife, mother of two. So with all of that being said, Dr. Roxanne, I will turn it over to you.
Hey, thanks for that, Javier. Hi, guys. My name is Roxanne Edrington, and I'm a chiropractor, a clinical nutritionist, and I have been in practice for 32 years. What I want people to know is I also have a background in athletics, and when I was 35 and 37, I played women's professional football for Houston Energy, and I have the women's first Super Bowl ring. At age 48 and 49, I competed in Ironman competitions, so Ironman Florida and Ironman Texas. At age 50, I got my pro card in women's figure competition. At age 51, I competed on the show American Ninja Warrior. On age 52 and 53, I did Spartan races with my son. At age 54, 55, and 56, I continued to compete in ninja competitions, and I won the National Ninja World Championships 3 years in a row. 57, unfortunately, I had to have a shoulder surgery, but later, when I guess the end of my 57th year, I started CrossFit. So at 58, I competed in the CrossFit Open. I then went on to the CrossFit quarterfinals. Now, next week, I'm competing in the CrossFit semifinals, hoping to get a seat to compete in the 2024 CrossFit Games. Now, none of that stuff means anything. I mean, who cares what I did? In fact, I hate that those pictures are up. But the point that I'm trying to get across is a lot of the things that I have done that people consider, oh, that's cool, was in the later years of my life. So as I'm getting older, I'm getting better. Whereas a lot of my friends, as they're getting older, they're doing less. And it's not because I'm special. I know the reason why I'm still able to compete in some of these things, because sometimes I'm competing against 20 and 30-year-olds. But the reason why is because I'm very diligent on how I eat, but most importantly, I'm very diligent on nutrients. I know as we age, because of what I do, I'm a clinical nutritionist, I know what nutrients that I'm going to become deficient in, or most people come to deficient in, and by testing them and making sure that my nutrient status is optimal, I still feel like I can compete like when I was in my 20s. And I actually feel like I'm 20s. Now I'm an athlete, but there are people that aren't athletes. And I really feel that healthy aging is probably more important for people that are not athletic. You know, it's great for athletes when we do this because it gives us our peak performance, but it's not so great for people that are just aging, and they just think this is part of aging, and they just kind of, give in to what society says, that as we get older, we're supposed to feel bad. But I really feel that the people that aren't working out because they're too busy, it is more important for them than for athletes to really focus on healthy aging. And the reason why, a lot of these people are super busy. They're either taking care of kids or parents or work, or they're taking care of all these things, and they put their health on the back burner. But unfortunately, they keep putting their health on the back burner until finally one day they wake up and they're really sick. And this is unfortunate because they can do things early on, preventative, and if they were more proactive, they can continue to gracefully age, have good energy, feel fantastic, and continue to enjoy life. So research states that after the age 40, 1 in 3 people are insulin resistant. Now, I came across this research maybe 10 years ago. So recently I kind of looked at it again, and now research is saying that after the age 40, 1 in 2.5 people will be insulin resistant. And I don't understand the 2.5. I don't understand that, but this is what research says. So since we know that after the age 40, 1 in 3 people are going to be insulin resistant, what we also know is that we really need to be preventative, because I don't want to be the 2 or 3. I want to be the one that's not insulin resistant. So we all need to be checking this, because we know that if you become insulin resistant, this is the beginnings of getting other chronic illnesses like diabetes, heart disease, PCOS, osteoporosis, cancer, and many other things. But by testing your micronutrient status, you can see what nutrients you're deficient in or what you're becoming deficient in, and you can customize, or the healthcare provider can help you customize a nutritional regimen specifically for your needs. And what I like about this is it really eliminates any guesswork, because a lot of times we just try things, waste a lot of time, waste a lot of money. Now it's great because we can do the micronutrient testing, see exactly what we need, and just focus on that. And that's why I like SpectraCell's micronutrient testing. This test is awesome because you can, again, we can eliminate the guesswork, because we know through extensive research that there is a strong correlation between vitamin deficiency and developing a chronic disease. So we really need to take this seriously, because look, we only live once, right? This isn't a dress rehearsal. So we need to take this seriously, and we need to yell at the top of our lungs or do whatever we need to do for women, that it's so important that we have adequate nutrient levels so that we can age gracefully and have optimal health. So the big takeaway here on this micronutrient testing is that the micronutrient testing provides individualized data on specific nutrient deficiencies, which allow for tailored interventions to improve the management of women's health. So if I had a mic, boom, I would drop it right there, because that in itself is huge. And it's so easy to do. So now let me kind of talk to you a little bit about some of the micronutrients that are really important for women's well-being. So PCOS. I have so many patients that come in here and they have PCOS. Now, unfortunately, a lot of the doctors will actually put these patients on birth control pills. And I'm not saying that that's good, and I'm not saying that that's bad. I'm not going to go into that. But what I do know is this. Not one person that's ever taken this micronutrient test showed that they had birth control deficiencies, right? So, but when we do the micronutrient testing, what we do see with these individuals is that they do have deficiencies in vitamin D and vitamin B and magnesium and antioxidants. And when we address these micronutrient deficiencies, I have seen great results in managing the hormone imbalances and promoting better health. I've also seen people that do the birth control route, and that route looks very different. And the reason why is because we are not getting to the root cause of why they're having the hormone imbalance. And when we figure out what the root cause is and we support it, we have really good outcomes. Same thing with PMS. Most women get PMS. And with women, we're kind of funny because we see little shiny things. We see, oh, a pill for this. Oh, a potion for this. Oh my gosh, my friend is taking this. She has no more PMS. Oh, this is awesome. Women jump to all those different things. And that's great. And you know what? Some of these things do help alleviate some of the PMS. But what I usually tell people, like, okay, it might help, but it's still not getting to the root cause, the actual thing. So by micronutrient testing, that's going to tell us specifically what we need to do to support the right pathway to help alleviate the symptoms. Some of these other things might be patching up some stuff, but really to get to the root cause of your PMS, we need to test it so we can figure it out, so we can really just focus on that instead of taking all these pills and potions and lotions that we're doing. Another thing is hormones and hormone replacement therapy. Okay, so I know as we age, we do start having imbalances in hormones. And again, we really need to test because women who are struggling with these symptoms of imbalanced hormones need to know exactly what nutrient deficiency that they're dealing with so they can make sure they're supporting their hormone health. But additionally, women that are taking synthetic HRT or synthetic hormone replacement therapy, they need to be doing micronutrient testing, and not even just the women doing synthetic HRT, but women taking medications really need to be doing the micronutrient testing, because anytime you take a drug, you're depleting vitamins and nutrients and minerals. You are. That is just across the board. Any drug you're taking, you are depleting nutrients. Right? And at first the HRT can work great. And at first the medications can work great. But if we're not following or watching for deficiencies that possibly could be surfacing, we are actually setting ourselves up for something else to surface down the way. You might have unbalanced hormones now and the hormone replacement might be helping, but if you get depleted in several things like B vitamins and vitamin D and stuff, now you might be dealing with depression. Now you might be dealing with some other discomfort, cardiovascular disease, because you didn't monitor some of your depletion. Again, some other things like menopause, breast cancer, and fertility or reproductive health. These are great things to also micronutrient testing helping, because we know that when women enter menopause, they do face lots of micronutrient deficiencies, which can contribute to cardiovascular disease and other concerns. But proper supplementation and monitoring can help mitigate these things. Breast cancer is a big thing for people as well. We know that adequate amounts of antioxidants, vitamin D, and calcium has been shown to play crucial role in maintaining healthy breast tissue and reducing breast cancer. So every woman who is worried about cancer, who's worried about, breast cancer, need to be doing this micronutrient testing, because one, we can see what nutrients that we are becoming deficient in, and again, we can support those areas to make sure that we have optimal breast tissue, but also optimal health. And it's interesting, people don't realize this, but I promote this all the time. When you're pregnant, before and after, this is a great time to do the micronutrient testing, because obviously the healthier the mother is, the healthier the baby's going to be. So doing a test prior to see what you're deficient in and continually monitoring that through your pregnancy and after your pregnancy is going to be great to help you to personalize a supplemental regimen or even some other healthy lifestyle changes that you need to do to improve the pregnancy outcomes and better maternal fetal health. So now I kind of want to move on to heart disease prevention in women. So heart disease, there we go. Heart disease is the #1 cause of death in women. I'm going to say that again. Heart disease is the #1 cause of death in women, but surveys show that women think they're more likely to die of cancer. But here's the thing. Heart disease kills more women than all the types of cancers combined. So because of this, it's so important for women to be proactive to prevent cardiovascular complications, which can lead to early death, because we already know it's the #1 killer, right? So we need to be proactive. We need to be telling everyone we need to look at this because we can prevent a lot of things. But I know a lot of people, when I talk about heart health, my patients will say, well, I'm taking fish oil and I'm taking CoQ10 and they're taking heart health supplements, and that's great. But women often experience unique cardiovascular risk and symptoms, meaning no two women are going to present the same risk factors and the same symptoms. Therefore, it's extremely important that we find out or know exactly what each person needs to take for their individualized situation. And again, this emphasizes the importance of tailored prevention strategies and early detection to help women with their overall health. So SpectraCell has a test, and the test is called Cardiac Nexus Test. And this test points out heart disease risk factors specifically to women for lipoprotein particle size, lipoprotein distribution, and the genetic variation of like MTHFR. Now, why this is important, because a lot of my patients go get a lipid panel from their doctor, and they get a clean bill of health, only to find out later that they had a cardiac episode. And I'm sure you've seen this a lot. People go to the doctor, their labs are perfect, but they, have a heart attack 2 or 3 months ago. You might not see it a lot, but this happens. You've heard about this happening a lot. And the reason why is those lipid panels don't look at the lipoprotein particle size and distribution. So this is very important. And being able to know if you have a genetic variation like MTHFR. Now, this test is very special or important to me because I had a situation when my brother died of a heart attack at 53. I was 43 at the time, but he was obese. He smoked, and he drank a lot of like Cokes and stuff like that. So his diet was terrible, right? So it wasn't a surprise for me that he died of a heart attack. But 53 is really young. Like I thought maybe in his 70s. And then it wasn't long ago, I think a year and a half ago, my sister at 65, she also had a heart attack. And she didn't die, but she did have to crack her chest open and have a quadruple bypass. Now, the cardiologist with my sister said, hey, this is a genetic thing. Because what I found out after my sister's episode is that no one on my father's side has cardiac issues or heart disease. No one on my mother's side has heart disease. It was something about when my mother and father came together. There was something that created 2 out of their 3 kids had heart attacks. So I was forced to go to the cardiologist and stuff. And thank goodness for me, in my late 20s, I did a genetic test, and I knew that I was homozygous for the MTHFR mutated gene. So in my 20s, I started supporting my system with nutrients like folic acid and other stuff to support that deviated pathway to make sure I was supporting it. And I am 100% sure that because I did that is why I didn't have a heart attack, or that's why there's not a heart attack in line for me in the future. I went to a cardiologist this past year. Everything is great. I don't have any plaque buildup. I don't have anything. And I told him I was homozygous for the MTHFR mutation. And he asked me what I was doing. And I told him I was taking methylated B vitamins and some other stuff. And he goes, well, keep doing what you're doing because I think you definitely are supporting that. Because when you have an MTHFR deficiency or a mutation, that your body's not going to, you're going to start making a lot of homocysteine. Your body isn't going to convert homocysteine back to cysteine. So you're going to have elevated amounts of homocysteine, and elevated amounts of homocysteine create a lot of damage, inflammation, and can create heart attacks. So for my brother and sister, their death, well, my sister's chest cracked open and my brother's death, I feel like could have been helped or it could have, not happened if they would have taken a test like this and known that they had risk factors. And so this is really important. And again, everyone should be doing it, especially the MTHFR. You don't have to wait till you're older. A lot of people think this cardiac nexus test should be when you're older or when you're getting older. No. If the earlier you can take it, the better, because once if you do have the MTHFR variation, or if you know maybe genetically you have the lipoprotein issues where the particle sizes or the distribution is out of whack, definitely that's the time to start, not when you already start creating damages to your arteries or even to your heart. So this is a real important, even if you don't have heart disease in your family, like me, this is something that you really need to do, especially women, because it's the #1 killer is heart disease. So every single woman should be thinking about doing this for better overall health. So the next thing I'm going to talk about is this telomere testing. And I love this because I can't tell you, probably you hear this in your circle of friends as well. I can't tell you how many women, when I'm talking to them, they're like, I just look at this and look at this, and they're doing all this stuff, and like, I just want to get younger. They start telling me, talking to me about Botox. They start talking to me about facelifts. They start talking to me about laser resurfacing. They come to my office and they're beet red like tomatoes and all this stuff. I'm like, oh my gosh, what did you do? And they're telling me all this stuff, and I'm like looking at them. I'm like, okay, let's talk about this. You know that we age from the inside out, right? We, on a cellular level, like we age from the inside, and then it kind of surfaced to the outside. So all these potions and lotions and shots and everything that everyone's doing, it might be a quick fix for maybe a couple months, but it's all going to come back. So unless people are focusing on the inside on a cellular level, you're really not going to help with like slowing down your aging or anti-aging. I mean, I am sure there's a lot of people pass away that maybe look beautiful on the outside, but that's not going to help them once they've passed away because they were on a cellular level unhealthy. So let's do it the right way, and let's focus on the inside on a cellular level, because if we do that, it's going to express itself on the outside. So the telomere testing. So what telomeres are like little protective caps that are found at the end of the chromosomes. And I like to explain it to people like shoelaces, those little caps on the end. That's kind of what telomeres look like. And in almost all animals, telomeres are required for cellular division. And with each replication, the telomeres get shorter and shorter and shorter until your cells they're so short, your cells can no longer divide. That is when the tissues start aging. However, the shortening and the lengthening of telomeres can be modified, and it can be modified by our lifestyle habits. Poor lifestyle habits are going to increase the shortening of the telomeres, whereas healthy lifestyles can help increase the length of the telomere. And what I love about the SpectraCell's telomere testing, it's a great way to determine your telomere length. So basically it's telling you how old you are biologically, not chronologically. Like I've already told you, I'm 58 years old. I don't care chronologically, I'm 58 years old. I more care about how old am I biologically. And so I know people who've done this test, and basically they were like 45 years old. It said one person in particular, they were 62 years old, according biologically, so that's not good. And then there's other people that I've heard taking the test that they were like, 65, but biologically they were like 47. So this is the best way if you really want to know how fast you're going to age. This is the best way to do it because it tells you, according to your telomeres, how old you are biologically. And what I also love about this test is not only it tells you, strategies for telomere length maintenance or extension, also they include recommendations on what healthy lifestyle changes or strategies you need to implement so that you can lengthen the telomeres and you can basically anti-age. So this helps women customize a great plan for them to help reverse aging and improve their cellular rejuvenation. Something we all can use. So remember, I talked about just a second ago, a couple slides before, that 1 in 3 people or 1 in 2.5 people after the age 40 are going to be insulin resistant. Well, if you're 40 years old and above, this panel is really important for you. Not even 40 years old. I'm just saying, if you know that you have diabetes or prediabetes, if you know you have that in your family history, you should be taking this as soon as you can in your 30s, right? Because prevention is always the key. Because I can't tell you how many times I have people who come to me after they've gone to their doctors and they have their labs, they bring their labs to me. Their glucose, their fasting glucose is 102, and their A1C is 5.9 or 6.1. And the doctor says, okay, that's pretty good. You look pretty good. Okay, no, that's not good. Because in my opinion, they're diabetic. And they're like, well, he didn't say I was diabetic. Okay, look, kind of like either you're pregnant or you're not. You're also diabetic or you're not. There's not little baby steps. I mean, to become diabetic, it takes like 5 years. You don't just wake up one morning and you're diabetic. You don't just wake up one morning and you have a disease. It's been brewing for a long time. So what I love about this cardiac A1C panel is it helps you to see early on if you're going down that wrong path. Right? So it looks at your lipoprotein, particle size, all that stuff, because generally when people become insulin resistant, we'll see it in their lipids, their triglycerides, and in their blood sugar. But if you take a snapshot of that, with a lab, you're not going to see that. You can't even see it on a lab that you're insulin resistant. But if you're monitoring your A1C and if you're monitoring your lipoprotein particle size and distribution, that is the best way to be able to see what direction you're going in. Because if you know you're headed down the path of becoming pre-diabetic or diabetic, the sooner you can start mitigating that, or you start putting strategies in to reverse that, the less damage that you are going to create in your body. Because diabetes, high blood sugar, is inflammation. You basically, if you're pre-diabetic, as they say, or your blood sugar is a little bit high, you are walking around, your body is basically on fire, and you are not going to feel good. And you're going to have a lot of aches and pains and inflammation. I have seen so many people who are considered diabetic. Maybe their A1C is 6.5, maybe they're even on insulin. And just through lifestyle changes and monitoring their A1C and making changes, they've actually reversed it to where they were off their insulin and their values were normal. So if you've been diagnosed with diabetes or something like that, don't fret, because there is a way, there's lifestyle changes that can help you. But during the process, you need to have a way to test to make sure that you're on track. Right? We need to be able to monitor this, because we don't want to, start and, oh, it looks like it's working, and then stop checking it out, and then you end up where you're at. So this test is very important for that. And another thing this test is great for, because there's a lot of people out there that are taking the GLP-1 drugs, right? So they're doing like Ozempic, Mounjaro, Wegovy, all different things. And first of all, some people have great results, and some people don't have that good of results. But let me say this, when you go get that test, a lot of time, when you go and get the shot, or when you go talk to a doctor about it, a lot of times they're not really testing you. They might test your A1C and say, okay, let's go ahead and take this, but that's it. Now you have a way to monitor how you're doing. You don't have to go to the medical doctor. You have a test now that you can do to monitor its efficacy. Is this working? Is my A1C getting better? Are my lipoproteins getting better? Or is the distribution or the particle size, like all this stuff? Now you have a whole bunch of information so that you know that this drug is helping. Because if you take it for 6 months and you're not seeing a change, then probably you need to do something different. That was a lot of wasted time and a lot of money that you wasted on putting your efforts towards something else. So this is a great way to monitor the efficacy of those GLP-1 drugs that you are doing. And then finally, I want to talk to you about the micronutrient testing for mental health. Now, what's so funny about this is they threw this in the women's webinar, right? Okay, men need this too. I really feel like the reason why they put this in here is because they know that women are smart enough to take action if they feel like maybe their health could improve. And men, well, let's just say they might not be as prone to do that. So, but everyone, if you are battling, depression, anxiety, or even kind of mood disorder, you just feel blah, this is a great test to do. It's like the micronutrient test, but it goes a little further to evaluate your micronutrient deficiencies and how they could be playing a role in your depression, your anxiety, and other mental health conditions. I have seen so many people that come to my office and they have normal dopamine, they have normal serotonin, but they feel depressed. And what I found out in time is that they really had low levels of tyrosine and phenylalanine, B vitamins, and some other stuff. When we started repleting their body with these nutrients, it was like night and day. They felt fantastic. And I have other people who actually have taken the antidepressive medication and they didn't really feel much better. And I feel like the reason why they didn't feel much better because we didn't get to the root cause, because we need vitamin C, we need vitamin B, we need tyrosine, phenylalanine, a lot of things we need for our body to make these brain neurotransmitters. And if we don't have the ingredients to make them, we're going to feel awful. So getting tested to see what you're deficient in is the best way to figure out what you need to do to support your brain health. Again, don't guess, just test. It makes it so easy. So here's some nutrients that are important to mental health. We definitely need to have adequate amounts of vitamin D, B12, magnesium, folate, and other amino acids. And carnitine, zinc, chromium, and inositol really can help the efficacy of antidepressant drugs, particularly in people that are resistant to the antidepressant medications, because it helps regulate the brain neurotransmitters. So all of these things are really important for the mood disorder. So again, the bottom line that you keep hearing me say is that the strategies we need in order to deal with mental health is we need to basically have a balanced diet. We need to supplement with key nutrients that we know we might have deficiencies in because we tested, like vitamin D, B12, magnesium, and other nutrients. But the other important thing is for mental health as a whole, and I want to make sure people understand this, it's not just about repleting your body with nutrients. We also need to keep monitoring our micronutrient levels, but we also need to integrate this with medical, psychological, and nutritional interventions to ensure that people are getting a comprehensive treatment plan to improve their overall health outcomes. Okay, so here is a case study. 52-year-old female with a history of breast and ovarian cancer treatments, including lumpectomy, partial mastectomy, chest irradiation, and bilateral oophorectomy. So her current health issues: chronic stress, problem sleeping, low energy, they were depressed and had some anxiety, and they had a gluten intolerance. Medications they were taking: multivitamins, Valium when needed, and intermittent use of testosterone and skin cream. After doing the mental health micronutrient test, what we found out is she was deficient in oleic acid, zinc, glutathione, cysteine, vitamin E, selenium, CoQ10, lipoic acid, and vitamin C. Some of the nutrients we prescribed to try to optimize those micronutrient deficiency was calcium citrate, magnesium, vitamin D3, EPA, DHA, zinc, NAC, vitamin E, selenium, CoQ10, lipoic acid, and vitamin C. We also recommended different lifestyle habits. We wanted her to incorporate weight-bearing exercise 5 times a week, along with continued use of the testosterone skin cream for hormonal balance. So the outcome of this: one, we know we reduced the risk of fractures and hospitalizations because of bone health. We also lowered the risk of cancer reoccurring because we're monitoring her antioxidant levels. She has improved quality of life. She feels good. And I really think it's because the exercise and repleting some of the deficiencies she's had, along with her hormonal status. And then finally, she was able to increase the amount of medications, the anti-anxiety medication she was taking, again, giving her a better sense of overall wellness. And we did all this without bombarding her with medications and everything else. So this outcome was great because you see the person going from just feeling like, you know, life is terrible, they can barely go on, to all of a sudden really thriving in life. And again, it was just because we supported their deficiencies. Like I like to say, we got to the root cause of the problem and repleted those deficiencies so that her overall well-being was off the charts.
Well, Dr. Roxanne, that was an amazing presentation. And for those of you that were able to join in, we again appreciate you taking time out of your busy schedule to do so. We know it's lunchtime here centrally, but maybe a little later on the East Coast and earlier on the West Coast. But just to recap, again, she did an amazing job of explaining the benefits of how our various tests can help so many individuals. It's the one thing that we focus on every day here at SpectraCell. It's about how many lives can we impact daily. And for those providers that are on this webinar, we've created a coupon code for you to write on your requisitions as you send them in for your patients. That's going to be MH20. Again, MH20. And so write that in the special section on your requisition. And for those of you that are viewing online because you've heard about us through social media, when you go to shop.spectracell.com, these are the 5 tests that Dr. Roxanne so perfectly presented, the benefits not as just to women's health, but also for mental health for both men and women as well. So the mental health test is one of our wellness panels. The micronutrient test, as we call MNT, is on that website as well. The cardiac nexus, the telomere test, and then lastly, the Cardi A1C. We appreciate everyone's time. Thank you for Dr. Roxanne and an amazing presentation. This is Javier Sandoval from Houston, Texas, signing off. Everyone have a wonderful day, and let's help us help change the lives of so many millions of people around the world. Thank you very much. Goodbye.